I'm Barbara Kennelly, President and CEO of the National Committee to Preserve Social Security and Medicare. We have 3 million members and supporters from all walks of life who share a passion for preserving Social Security and Medicare for themselves, their children, and their grandchildren. I have been traveling around the country speaking to seniors who are dependent on Medicare. They are worried and concerned about how it will be affected by health care reform. I have also found there are many seniors who don't understand one simple fact. The status quo is simply not an option. For those seniors who believe they can continue in the same Medicare program they know and love, even if health care reform fails, I say that's not going to happen. Speaking as someone who has worked all my adult career to protect this vital program, I can say with great certainty, rising health care costs are going to destroy Medicare if we don't do something now. Every senior I speak to knows that their cost of medicine is going up. Premiums have doubled over the past 8 years and will double again in the next 8 years if we don't fix the health care system. Prescription drugs, which so many seniors depend on for their health and well-being, grew 10% last year. Even though inflation was so low, there was no Social Security cost of living adjustment for the first time since the program began. Eventually, health care costs will consume the entire Social Security check. Medicare simply won't be affordable for either beneficiaries or the federal government if we don't do something soon. And the answer is not just to cut Medicare. Unless we slow the rate of growth of the entire system, seniors will get priced out of the market. Medicare is part of the whole health care system. It uses the same doctors and hospitals, MRI machines, as the rest of the system. Also, Medicare pays doctors and other providers less than private insurance. If you cut Medicare reimbursements, the difference will get bigger and bigger, and providers will lose so much money they'll refuse to stay in the system. Seniors will be left struggling to find someone to give them the health care they need. No matter what the doomsayers and fearmongers say, the bills being worked on will help strengthen Medicare. Health care reform will extend the life of the Medicare Trust Fund for 9 years, help slow the growth of Medicare premiums and out-of-pocket costs, begin to close the dreaded donut hole which prevents some seniors from obtaining their needed medication. No bill is perfect, but let's not let the perfect be the enemy of the good. The House and Senate bills are good for Medicare and good for the country. Seniors shouldn't fear health care reform. It's the last, best chance for protecting Medicare.